CDPAP is a statewide Medicaid program for qualifying individuals who need assistance with everyday tasks such as cleaning, activities of daily living, or shopping. CDPAP allows them to choose and manage their own caregivers. So what's an example of this? Perhaps you know someone with a disability, someone who's elderly in need of assistance, or who has suffered a recent injury and is currently in rehab hoping to return home. Right now, here are your options. You can put your loved one in a nursing home or in a long-term care facility. However, good nursing homes are hard to find, and other long-term care facilities can be very expensive. Alternatively, you can find a home care agency that will assign a caregiver for your loved one. The U.S. is currently facing an immense shortage of personal care aides. This could result in your loved one having to be placed on a waiting list for an aide. Once the home care agency does assign an aide, it's possible they could have an inflexible schedule or limited hours. And it's also possible you may not be able to communicate with them or are just unsatisfied with the level of care. There aren't many other options. So now what? Because quality care is hard to find, people are taking matters into their own hands. Nearly 35 million Americans provided unpaid care to a loved one last year. A large number of them were required to quit their jobs or drastically reduce their hours at work to care for their loved one. Last year, that number equaled 8 million. It's through these numbers that inspired the creation of Burd Home Health. Our goal is to spread the word and help people throughout the state of New York get the care they need. The Consumer-Directed Personal Assistance Program, CDPAP, allows you to choose your own caregiver. That can be a son, daughter, grandchild, relative, friend, neighbor, or even an aide you have found on your own. You can choose as many caregivers as you'd like or have one dedicated person that you trust. You can manage who provides the care, when they provide that care, and even train them to your own standards. The caregiver of your choice doesn't require a license or certification, and they can even perform some skilled nursing tasks. Burd Home Health works with the state to pay that caregiver on your behalf. The best care for your loved one will come from somebody you know and trust. Call or text today to learn more about CDPAP and the benefits that Burd Home Health can offer.